Hi everyone, Jomar Ferralis here, Doctor of Physical Therapy. I wanted to talk to you guys about what you should do if you see a referral, whether you're in the outpatient or home care setting. If you see a referral from a patient's doctor with either chronic pain or myalgia or fibromyalgia or any other non-specific diagnosis, from the very get-go, you need to establish a discharge plan and appropriate goals for this patient. If you check out my other videos that I've made, there's a couple tips on there that should be able to help you transition and discharge these patients. But I've found that a lot of times when these patients are referred, whether in outpatient or in home care, there's an unrealistic expectation that they think that they're going to be on services for the rest of their lives to manage this pain. Now, some patients would maybe benefit from it, but at the same time, you have to think about, am I doing something passive that is making this patient dependent on my skills as a therapist? As a therapist, your goal should be to get your patient to buy in to the idea that active treatments are better than passive treatments. Now, it's all going to depend on the patient. In home care, at least, we get a lot of these referrals that are also very psychosocial in nature. So you're going to have someone with chronic pain, but they also have anxiety, depression, other, a host of other mental health issues that might hinder their progress. Now, from the get-go, what I do is I set up realistic goals and I tell the patient up front, listen, we're going to do the best we can to try to give you the tools and teach you things to help you with your pain. But in the end, these services do have to end at some point, and we have to set you up with an appropriate plan that you can use yourself to help manage your pain. So I've found that by setting them up right away at evaluation or start of care, by telling them these things, they're more likely to have a discharge later on that they feel comfortable with. I know in home care, sometimes, you're recertifying patients over and over, which is not, the best thing to do, but, every case is a little different. But by saying those things up front, you're telling the patient, listen, eventually this care will transition back to you and is going to be your responsibility to take control of your life and to implement these things that we teach you, which ultimately is the goal for skilled therapy. Is you need to be able to teach these patients the tools and the things that they need for once home care services are over, because home therapy is not supposed to continue on forever. And the same principle applies to outpatient physical therapy. You get the same patient over and over again. It's a frequent flyer. Here they come, they're back. So you really need to set up realistic expectations with them. And, in the end, that will help you when it is time to discharge them. All right, guys, that's my video for today. Thanks for watching.